talk a little bit about female sex drive. There are some new diagnoses that doctors use, but it really just comes down to a lack of libido or lack of sex drive. We've got hypoactive sexual disorder, meaning that you're not having as much of a libido as we would expect or as other women. There's female sexual arousal disorder. These are just labels. We've talked about labels before. What's the real problem here? It's not that you have a disease that takes away your libido. What happens is, for some reason, either hormonal imbalance or some other physical reasons, you don't have the sex drive. Or maybe you have the sex drive and you can't enjoy sex because of pain or other problems. So what can you do? If you're a little bit anemic, that can affect sex drive. Other things in your blood chemistry can indicate certain disorders or problems in the body that are going to affect you. Remember, you have to be really healthy to have a healthy sex life. If you're prone to diabetes or if you're pre-diabetic, that's definitely going to affect your ability to enjoy sex as a female or as a male. If you smoke, you're going to be affecting circulation, you're going to be affecting blood flow. So there are certain things you have to do in taking care of yourself so that you can enjoy sex to its fullest extent. Alcoholism, drug abuse, a lot of medications that women use can directly affect sexual desire. Again, we want to talk about whether or not women have the desire for sex, but also if they can enjoy sex physically, because many physical problems affect your enjoyment of sex. It has to be comfortable. It has to be something that arouses you. There is a real component of enjoyment to sex. It shouldn't just be a mechanical performance. There's something doctors refer to as post-baby coolness or postpartum depression, many different labels for it. It is true that your sex drive is going to be much less after you've delivered a baby, but for most women it does return not long after giving birth. If you're finding that it doesn't return, there are things that you can do, even some behavioral therapy that can help. Certain prescription drugs, especially tranquilizers, can definitely affect sexual drive in a female. Also, a lot of the antidepressant drugs, especially the SSRIs, directly affect hormones and neurotransmitters in a way that's going to lower sex drive. It'll also make it so a woman cannot get aroused as easily, as quickly, and have as much fulfillment in sex as she might have if her body was working correctly. Certain drugs, such as antipsychotics and some of the antidepressants, can stop a woman from actually reaching orgasm. Now, most women are capable of getting to orgasm if they're healthy, but there are certain drugs and even certain things in foods that can stop you from reaching orgasm, and it's a biological process that the body has been interrupted in. Many times women have hormonal abnormalities. You can have, as we've mentioned before, a lowered amount of androgens. You can have inactive hormones such as testosterone because of sex hormone binding globulin, but even luteinizing hormone and other hormones in the body can affect sex drive. It seems that insulin has an effect on sex drive. Any hormone is interacting with other hormones and can have an effect on the function of your body. And again, if we affect function, we affect your sex drive and we affect your sexual enjoyment. We also have to consider a lot of things such as stress, fatigue. This is all going to play into a woman's enjoyment of sex. Not just a woman's, a male's as well, but women seem to be affected by it more. We all know that males can rise to the occasion in a sense. Women work differently, and it's something that we know intellectually as men, but we have to realize that stress can affect hormone levels, stress can affect body function. As we talked about before, stress actually can cause different set points to change, can cause the body to adapt. We can adapt in a good way or in a bad way. If you're under stress enough of the time, you can cause damage to neurons. That means you're not going to feel things as well. You're not going to be aroused mentally because the stress has actually done the physical damage. So the stress can cause the hormones to be imbalanced. It can cause damage to the nervous system. It can cause damage to the circulation system. What this is going to mean is that your body cannot function sexually. So you need to do a lot of things in the way of health to have sexual health. You can't just not eat right, not exercise, not take care of yourself, and expect that sex will just happen in an enjoyable way. Women out there have to take care of themselves. It's not just for appearance either. It's for actual sexual function, sexual enjoyment, sexual arousal. So if you, as a woman, cannot reach orgasm, cannot be aroused, don't enjoy sex, and are just doing it out of duty or out of wanting just to do something for someone else, you're really losing out on the whole experience. So find a way to take care of your health, get your body functioning better, limit or really get away from the use of medications, and you'll find that the sexual experience can be very much enjoyable and something that you can look forward to and share with your mate at a much deeper level.
There are over 350 videos on our channel, and I doubt you've seen them all. And the topics range from weight loss, nutrition, sexual health, all the way to psychology and mind control, and anywhere in between. And I think if you check them out, you're going to find some really interesting stuff.